my understanding is that at least in urban India, there's been an increase in allergies, food allergies, environmental allergies. Are we exposing ourselves to more, pollutants, to allergens? What's going on?
So let's dissect that a bit. Sure, I think there is some form of food allergy. But before I get into answering food allergy, I'd like to talk to your listeners a little bit about the difference between food allergy and food intolerance.
Yes, please.
Now, food intolerance is the absence of an enzyme that digests that food. So, lactose intolerance.
Yes.
So, child, when we are all born, we all have the ability to digest the lactose that is in the milk. Over time, because evolutional wise, we are not supposed to be having milk after a certain period of time. As part of the evolution, you lose that enzyme to digest lactose or milk. Such individuals later in life, now when they have milk, they will get bloating and distension. Now that is intolerance, not an allergy. Both appear the same way. You feel uncomfortable after a food, but that is intolerance. So if you know the food, for example, wheat, celiac, it is intolerance to the wheat. It's not an allergy. Whereas an allergy is a different reaction. It's an eosinophilic reaction which can be treated by just antihistaminics or avoiding that food. So, of course, avoidance in both. But usually food allergy will be that when the person has that, the one we recognize is the person will come like, it's the same as drug allergy. You get rashes, dots, these red spots. Some of them will get a difficulty in breathing.
Yes.
The asthma attack, the complete anaphylactic reaction. That, fortunately, is not very common in the lay public. Is it there? Yes. Partly because of increased use of coloring agents in food. So, coloring agents drive a lot of the food allergy versus the intolerance. Can somebody be allergic to food? Yes, but let's talk about I'll give you an example to talk about the food color. So I've had a couple of children who come to me and say, when I have butter chicken or butter paneer at home, I'm fine. I have it in the hotel, I'm uncomfortable. I get a breathing difficulty. So it's a color that is in the food. So that's the coloring agent. Now, why I tell my patients to be very careful about this is, I do not. So it's usually we get these asthmatic children come to us and the parents would say, "हमने ये सब बंद कर दिया." Now, my thought is, and this is a very serious thought, is that I can treat his allergy, but I cannot treat the defect that you've created in his mind, telling him he's a defective piece. It's not common. So if 1 out of 1,000 will have chocolate allergy, 1 out of 1,000 will have, say, a chicken allergy, 1 out of 1,000 will have, ultimately it's 3 in 1,000, but each person has only 1 in 1,000 chance.
Yes.
So I don't stop people's foods unless I can be sure that when he had that food item, they definitely had a reaction. So one should do a very detailed analysis before you come to the conclusion. Common food allergens are, say, again, that is at 1 in 10,000 is fish, shellfish, occasionally chicken. In veg, we see with one I've seen repeatedly is allergy to chana. Do we have medicines for it? And answer is yeah. So since you talked about allergy and we didn't discuss it earlier, I want to give big hope to my asthma, COPD, allergy patients. We now have drugs which can completely, which significantly, I would say even completely remove the allergy. So these are biologics.
Okay.
Okay? So these are biologic agents, which we've been now with us for about 15 years. So where do we use them? We use them. So I have these individuals. So my who are constantly running nose, sneezing, have no nasal sprays, have lung sprays, have to keep taking tablets of steroids. Those are my really severe allergic asthmatics. When we switch them to biologics, these are these injections which either remove the eosinophils from the system or they remove the IgE from the system. Lo and behold, allergy gone. So I give you the example. One of the first patients I used it probably now 15 years ago or more, when they were just introduced, is this young boy came to me because he had an allergy in the eye and he was losing his vision. So he went online, was very smart. Somebody in Germany told him, this new biologic has come, you may consider doing it. So he came to me because he had heard that I was doing it. And he incidentally had chronic allergic rhinitis. We talked about food allergy, severe asthma. He was on inhalers and very severe, such severe food allergy that he went to Thailand and they were cooking fish or prawns in the neighboring stall. He got an allergic reaction, so severely allergic. He could not eat bread. Now we started giving him injections for his eyes. We were really not worried about the rest of it because the eye we wanted to save. A year later into his treatment with this biologic, he comes and tells me, Dr. Mehta, I don't need my inhalers anymore. I don't use my nasal sprays anymore. And guess what? I can now have bread. So severe allergy has a treatment. So the question is, why is that not first line? Because of the cost.
Okay.
So you have to take an injection. It costs 10 to 12,000 now. Used to be 28,000 a shot. The imported ones yet cost 30,000. So we don't use it. But in a patient who's really severe, there is